does that mean you have to be very careful with medicating, say, a 13-year-old boy or girl because their brains are still developing?
Will this medication help improve the quality of life of this person? But if you're not relatable, you're done.
Come sit in the room with me.
Yeah,
This conversation,
please.
for my sake.
We're going to move on to the next section. This is our favourite section. This is new news, and this is all the new news in the mental health and wellbeing space that's coming out, so we can keep you guys up to date with everything. The first one, do you want to take us away?
Yeah, absolutely, mate. Yeah, so it sort of ties back to what we were saying earlier. So there'll be a lot of it we've already spoken about. But the Resolution Foundation launched a major report this week about the mental health crisis affecting young people in this country. It basically essentially saying 1 in 3 young people aged 18 to 24 have symptoms of depression, anxiety and bipolar disorder, compared to 1 in 4 20 years ago. I basically want to pick your brain as to why you thought that was and what you can do to combat it, just from a sort of parental point of view. Or
I would think with mental health, like I always think, like, err on the side of caution.
Mm-hmm.
Like, if you think it's a problem and if you're noticing changes, so how we diagnose is we're looking at, okay, and it's very short actually, but what you're looking at is over a 2-week period, are you seeing daily symptoms or daily changes where you're noticing that this person isn't maybe coping very well, or this person is displaying signs of poor mental health. So if you're seeing that, my advice is always don't wait. Like, don't think, oh, I'm wasting the GP's time. Don't do that. Like, if it was a weird mole on your body, would you take I'll just sit with that for 2 weeks and just hope for the best? Go and speak to your GP. Go and just get it checked.
Mm-hmm.
Just get it checked, and then you can either put your mind at rest. But I wouldn't, like, if you're noticing that there is a continual problem here, then wise to address it.
100%.
That's amazing.
Brilliant.
The second one we had was, I'm sure you know, but University Mental Health Week's coming up, which
Yes.
is next week.
Yeah.
And this was a shocking fact when we discussed it, but it says, this is something that caught my eye, was the share of full-time university students with a common mental health disorder has increased by 37% over the last 10 years, and it states that universities have become a hotbed for mental health problems.
Yeah.
1 in 4 students have a diagnosed mental health issue. 30% said their mental health has got worse since starting university, and 1 in 4 students would not know where to go to get mental health support at university if asked about it. That's crazy. Because having just gone through university, there are so many people struggling. I know Joe didn't go to university. I did. There are so many people struggling there. It's crazy because you leave a support system of school. This is my point of view. You leave a support system of school and then you go to university where you go out arguably every night, or in my case, I was playing rugby. So I'm up early for rugby, and by the time I'm leaving at 6 a.m. to go to the gym, there's people stumbling in from a night out and then sleeping all day and then going to a lecture and not making new friends, especially after the pandemic. What's your sort of view on mental health in universities as a whole? Because for me, having lived it recently, like I was there last year, it's horrendous. And I actually think the stats are probably, this from my point of view, the stats are probably worse than it says there from my friends and stuff. I don't know anyone in my sort of friendship group from uni who deep down wasn't sort of struggling.
Yeah. So, you probably guys would know this, but back in Dublin when I qualified, I worked in a uni as a psychologist.
Right.
So that was my job for almost a year. I worked for the DIT, which is one of the big unis in Dublin. So I was it was interesting because I'd been in uni, obviously training, and then I ended up working in a uni as a psych.
Full circle.
Yeah, being staff. And we were flat out. I mean, we were crazy busy in the uni I worked in. One of the there's a low. In fact, this could be its own podcast, really. If you think of an 18-year-old leaving home to go to uni, and especially if that's their first time, so if they've not gone to boarding school or they've just gone to the local comprehensive, then like that's a big transition. That's a massive
Huge
transition.
Underrated.
For like basically a teenager that you're sending them to live in another part of the country. on their own. I know they'd be in student halls, but they're still, you're basically saying, right, go and survive.
Yeah.
And maybe they've had no education around what that's going to be like. There's almost like an expectation that these are going to be the best years of your life. And of course they can be, but not if you're maybe a person that isn't ready for that transition. And that transition can be massive for lots of young people. But also, uni can be very lonely.
It's very lonely. Very lonely.
And so my last episode of my podcast is on loneliness. And I talk about this, that like there's one study done that you would think that more older people struggle with loneliness. And in one particular study they did, it was that the highest rates were in teenagers.
That's
not how it should
be. Yeah. Unreal.
It's crazy.
Well, that doesn't make sense because like they're teenagers. But again, it's the lack of connection. So the other piece of that, of course, is that the uni I worked in, we were so visible. So everybody knew who I was in the department I worked in. We had the open days around mental health. All the heads of the departments knew me. So if there was anybody in the class that they were worried about or that they were showing signs of, say, maybe not doing so well, they were flagged. The Students' Union flagged. So we had a pretty robust system in place in the uni I worked in. It was really good. And we had a good team of psychologists.
That sounds great.
It was great. But my experience of working here, I see lots of patients who are students, and it's a real mixed bag when it comes to the services that are available, but also the quality of those services.
That was the other thing I was going to say. Is like there's a difference between having people there and actually people who can do a good job and help you. That's funny you said that. I was going to say the last thing I was thinking as well when we were talking was exam stressed. A levels, GCSE, not just at university, but the exam stress you have at university to perform for a degree is ridiculous. And that's when everyone's mental health, like, it was visible to me. I feel like I read rooms incredibly well. I read people well. I read their emotions. I can tell when people are going wrong. And it was always exam season, even for me. Like I struggle massively in exam season because I didn't know how I was going to do. I ended up doing very well and I worked really hard. If you're, a lot of our demographic people watching this are 18 to 24 year olds who are at uni, and a lot of them will be sitting their exams soon. I think a lot of them will have finals soon. What advice would you give them for their exams on how to better deal with their mental health and sort of reduce that stress level if possible? Just a few like nuggets of advice that you give to them to do better with that.
Perfect. So the thing, first of all, to normalize, stress is a normal part of life. And the brain is built to take stress. If it wasn't built to take stress, we wouldn't cope with even very small things. So the problem you have with stress is when the stress becomes elevated, and then the stress then can tip into worry and anxiety. So that's different. So stress is just a normal physical response to we're doing something challenging or something that's maybe demanding of us. Now, where stress becomes an actual problem is when the challenge in front of you and the resources that you think you have to meet that challenge don't match.
Right.
Okay.
So where we get really, really stressed is when we feel under-resourced. So, for example, if I'm studying for my finals and I think, God, I've run out of time and I've left it all too late, then my stress levels are going to go through the roof because I can't create more time.
Yeah. So it's sort of preparing, knowing that's going to happen.
Absolutely.
And preparing earlier.
There's an end point here. But the other piece around the resources is resources around, again, the practical things, like getting enough sleep, making sure that you know what you're doing with your study. It's always quality over quantity, always. You just need to do the quality work. And then the other piece of that also is making sure that you are supported. So if you're struggling with your mental health or you need people to kind of step in and support you, get this support. So they're your resources, and those resources will help to alleviate your stress. But if you're not facing the stress head on, or if you go into, say, avoidance or procrastination, then that will just facilitate your stress and your stress is going to go higher and higher and higher, and that's when it tips into anxiety.
Yeah, love that.
Would you recommend CBT therapy for people who are struggling with exam stress, or not really?
Yeah, that can be helpful. I think if you're really kind of struggling with it, the things I think, mostly for exam stress is make sure you get enough sleep, like do some exercise. All that stuff is great for de-stressing. But the other main piece of that is recognize the task. Like understand what the task is, because the task is what we call, that's your stressor.
Yeah.
So you need to understand what is the stressor. And then in order for me, then you got to understand, right, what do I need to do to be able to actually manage and deal with that stressor? Because what lots of people with stress do is they just run with the feeling. And the feeling is, I feel stressed. And like, well, okay, yeah, we know that. But like, what's the source of the stress? And then you break it down and you go, right, how are you relating to this? So what is it about this particular thing that you feel overwhelmed by? So you break it down. And then you figure out a plan that, okay, well, if we're going to approach it, then what do we need to do to help you to approach it and to manage it?
God, I love this podcast
love
sometimes.
that.
It's so nice when you just have someone on who's just like, you learn so much.
Yeah.
That's the one thing I found from this podcast is I've learned so much about mental health. It's so nice to discuss.
I hope we know what we're talking about.
Yeah, I hope so.
He's not actually.
I know, yeah, totally, yeah.
The next,
Forrest Gump here. Do everything.
the CBT side of things, I was just doing some reading the other day and we ended up speaking about it, and there's a sort of new controversial mental health book that's come out by Abigail Shrier. Have you heard of it?
No.
It's
I
called...
thought you were going to say Jordan Peterson. I was like, not again.
That guy.
Not that guy.
It's called Bad Therapy, Why the Kids Aren't Growing Up. No, I'll read a tiny bit about it. It says it argues that most therapeutic approaches have serious side effects and few benefits, and she is highly critical of many mental health professionals. She asked an important question: if therapy is effective, why has the huge increase in spending on mental health treatment for Gen Z not resulted in less depression? But interestingly, in this book, which she is very critical about everything in the mental health industry, she views CBT as the exception, which she admits is evidence-based and helps people change their views on how they react to situations, which I thought was super interesting, because I think CBT is amazing. That was just from my point of view. But she also says she's highly critical of everything else. But you did psychotherapy, didn't you? Yeah. Which he said was amazing. So I wasn't too sure on that when I read it. What's your kind of overall view so far? Because it works so well for him, and CBT was amazing for me.
Yeah. I'm going to answer this from my own training and perspective. So, as in my clinical work, how I work. When I trained, I was trained in CBT, like I suppose lots of psychologists are. But I was also trained in other models of treatment. We did a lot of training around human development, and so really looking at the holistic view of the person. So also things like what we know from brain development is that the biggest influencer of brain development is not genetics, it's the environment. So you have to look at the environment. You've got to look at what did this person land into. You've got to ask about, the parenting. What kind of parenting did you get? And then you bring in all kinds of things, like you look at attachment styles, personalities, you look at trauma that the person's been through. And so you're building a massive picture of the psychological makeup of this person. And once you have that, then you can start to think about, okay, what does this person need? So I never go into a case thinking, right, I don't know how many cases of depression I've treated, probably thousands at this stage in my career. But I never go in thinking, I know how to treat your depression. Because I don't know what your depression is.
Because everyone's different.
Yeah.
That's so interesting.
In the same way that you and I play rugby and don't like running that much.
Yeah.
You love running, and it's just like one size fits all for
It
everyone.
can't be. And that's kind of the thing with CBT. CBT, it has its place, and I'm not knocking it. I really am not knocking it. Some of my patients have responded really well to it. Some of them come in and say, don't do that with me. Like, I don't want to, I don't
Doesn't
want
suit
that.
them.
Yeah. And I think where it's like any form of psychological treatment, you've got to figure out where the patient is in terms of what they need, but also you got to get to know them to think about, okay, what kind of treatment might suit this patient. So for me, how I approach it is, we know that the brain is like your fingerprint. It's unique. And the reason it's unique is because of the network. So the neural pathways are wired uniquely in every single person's brain. So you can't approach a case thinking that, oh, I've seen this before. Yeah, you might have treated the disorder before. Chances are, like I certainly in my case, I don't treat anything I haven't treated before now. So I know what I'm doing.
Yeah.
But I don't know what's going on in that brain.
I don't know how you do it. Well, like, I know you've studied it and you've done it for years, but every person is just so different. Like, it must just be. Do you still find it confusing, or is it kind of just like you just know?
Totally. Sometimes I'm sitting there thinking, God,
I can't figure this person out.
Yeah, I feel like I don't know anything. But I think that's good.
Yeah,
that is good, because I'll often
constantly learning.
Exactly,
as well,
and I'll often say to my patients, we're going to have to take our time with this, because some of the cases are really complex.
I'm fascinated by the process in which you find out what works best for that person. So how long does that process take from meeting, say I'm your client now?
Yeah.
How long does it take for you to, I guess it's different for the person as well. Would it take days, weeks, months to decide this is going to work best for you based on your environmental chemical makeup? How does that work?
So I tend to give myself probably a window of about 4 weeks.
Okay.
Where I say to the patient, right, we're just going to understand the story. We're going to try and build a picture of your life. And then I'm going to give you some feedback in terms of what I think we need to address here. So it's really collaborative, because although I'm the psychologist in the room, I'm not the expert. The expert is the patient. Because they're the expert on them.
Yeah.
So you very much are guided by them. Now, of course, you ask these certain types of questions. You're leading the conversation to try and get the information you need. But you're very much guided by the patient. You've got to be. Because if you don't get the story, and I think this just comes with time of doing the job. Like, you'll often get kind of your spidey senses. I kind of think they are, where you'll hear something, or something will be said in a kind of a non-verbal communication, and you'll clock it. And the patient might not even realize that, oh, that's maybe something quite significant, or that could be something that needs to be addressed, but you'll clock it.
Do you find that's a skill that you've got, though? Because I'm sure there are people in your field who might miss those visual cues purely because they're a brain, and they get the science behind it, but actually the human that's sitting opposite you might miss on those things. Is that a skill that you've got?
I kind
Without
of
blowing your own trumpet,
it must be. Yeah, I think. Yeah.
I'd like to think they all have it, because I would hope that they, because I think when you do the job, you've got to open up the space.
Yeah.
You've got to open it up, so you can't go in with a foregone kind of idea in your head, and also like, you're building a relationship with the person, and all the research will tell you, like, and going on to what you were saying, Tom, earlier about that book. But if you look, there's a big book I read when I was training. It's a big yellow book. I'll never forget it, because it was
not Yellow Pages.
It was as interesting as Yellow Pages. And it was called What Works in Therapy.
Okay.
Big. And it's a big book on, basically, they did, it's all the research around, okay, what is it that gets the change. And every single time, what it came down to, it's the relationship between the patient and the psychologist. That is it.
Okay.
So you can be the most skilled guy or girl going in terms of your training, but if you're not relatable and the patient can't form a therapeutic relationship with you, you're done.
That's exactly.
It's funny, isn't it? Because when I came on,
that's amazing.
When I came on to talk to Tom in sort of our first episode we did when I was a guest, I spoke about how I saw, I think it was 3 therapists before I met the right one.
Yeah.
And it was like, I just didn't have a connection with that person. And person number 1 and 2 were amazing, and they could work best for Tom or yourself. I couldn't warm to them. I couldn't open myself up, because to be that vulnerable and open up yourself to that person, you have to form a relationship with them.
Totally.
So 4th time lucky for me, and it was great. But
it's hard to share with people you don't click with. I think
Well,
that's what we. I think.
life.
Like, it's such an underrated skill that you have. Is you're a very likable guy. As soon as you walked in the room, we knew like it was going to be a good podcast. And I think when you walk into a room with a therapist, you know if you're going to click with them. You know,
do.
like exactly what you said there.
so important.
I had 2, so it was like I knew as soon as I walked through the door, I was quite lucky. I was like, okay, I can click with this person. It took me about 2 sessions to actually talk about something. I just sat there in silence the first one.
Yeah.
Looking back
because
at it,
it's a really vulnerable
it's
space.
such
you're
a
walking
vulnerable
into.
thing.
Like you're walking into some strange doctor's office, and all of a sudden you're going to get deeply personal. Like that's not the real world.
Yeah,
You don't do that.
no, you don't.
Like, and also to just assume that that's the way it's going to go. Like you got to get the patient on board. Like you have to build that trust in order for the patient to let themselves be vulnerable. But if they're feeling that they maybe can't connect with, they're going to be guarded, and then the essentially the treatment is over before it's begun, because they're not going to open up.
Yeah, actually spot on.
I wanted to ask as well, do you find men react differently to women in terms of therapy?
It's funny you should say that, because so traditionally, and I don't know why this is, I'm sure there's a study done on it, but traditionally in psychology, it is female heavy.
Right.
So when I was training back in Dublin, I think there was 19 people in my class, and we had, I think there was 6 lads. So, and that's kind of the case where it's definitely more female heavy. I don't know why that is.
Hopefully that changes soon.
I would like to think.
I think it
yeah.
is. I think a lot of men are being more open, like us, about our problems and stuff like that. And I think it's not a very nice thing to do. And I think you have to swallow a lot of pride in a way, from my point of view, if you are a guy doing that. And I think a lot of people just don't want to. I didn't want to. When I look back at it, like I really didn't want to go that. I just didn't have a choice because I was in such a bad way.
Well, yeah.
Whereas now having done it, if I could go back to that stage and tell 15, 16-year-old Tom when I was at the worst, I'd be like, mate, just go. Like, trust me, you're gonna it's going to be the best thing you do.
I do think that girls tend to exam better than guys do. And it's quite a tough, rigorous process to be able to exam for, isn't it? I think to sort of become one.
So the you got to do your psychology degree, and then you got to do your training. And I don't know, but like it's still very female heavy, and it's interesting being a male psychologist, because there's way more female psychologists than male psychologists out there, and they'll tell me, so some of the maybe the guys I see, not necessarily the teenagers, are there because their parents need them to be seen, or the doctors send them, but certainly some of the men I see, they will often say to me, I want to see a guy.
Interesting.
And I've also had
That's very interesting.
Opposite, where I've had women say to me, after, say, the initial consultation, that I think I need to see a woman.
But could that be trauma with a relationship they've had with a man?
It could be, but also
relatability, or not really.
It can sometimes even be that they don't. If there is some trauma in their past, that being on your own in a room with a man,
Absolutely.
that can be really triggering.
Yeah,
absolutely. I can imagine.
That's awesome. I'm gonna end it on this, and it's a question we're gonna try and start to the end of all our podcasts now, because I think it's so powerful, and it's in reflecting on our conversation today and considering all your experiences you've gone through personally, professionally. What is one piece of advice you wish you could give to anyone out there listening or watching, regardless of where they are in their journey, that you believe can make the most significant difference in their life?
It is human to be vulnerable. Vulnerability is not something to be scared of, and it's not something that you should try and run away from. Vulnerability is what it is to be an imperfect person. So if you're feeling vulnerable, don't try to fight that vulnerability, but actually deal with the vulnerability. I think vulnerability as a feeling, of course, it doesn't feel nice. It feels frightening. We feel very scared when we're vulnerable. But my advice would be lean into the vulnerability, like work with it, and let other people then support you when you're feeling vulnerable. Because although it's not pleasant, but the opportunity for growth out of vulnerability is massive. really massive, because you learn resilience, you learn what it is to endure things, your confidence grows, your ability to be able to take risks grows when you allow yourself to be vulnerable. But if you don't lean into the vulnerability, then you are at high risk of having very poor mental health, but also you don't learn. You don't get the skills that come out of vulnerability.
That's amazing.
Spot on.
Awesome, bro.
Absolutely love that.
Thank you so much for
Absolutely
coming on. We
love that.
appreciate it.